Herpes genital. Genital herpes is a highly contagious sexually transmitted disease. Pain, redness, itching, and heightened sensitivity in the vaginal area are all symptoms of the condition. The herpes simplex virus, HSV, causes the disease and enters the body through microscopic breaches in the skin or mucus-secreting tissues, with intercourse being the most prevalent mode of transmission. Genital herpes is a recurrent illness that cannot be totally treated, and it can cause embarrassment and psychological distress in those who are infected. However, just because someone has genital herpes does not mean they should not engage in sexual activity. This is because, if one of the spouses has genital herpes, they can prevent infection between them and transmission of the herpes virus from the infected husband to the healthy husband by exercising caution and employing particular preventative measures. Infections of many kinds. The herpes simplex virus can produce two types of infections, both of which can cause genital herpes. The first one is. This variety mainly causes mouth sores, but if you indulge in oral intercourse, it can also travel to the vaginal area. The second category. This virus is the primary cause of genital herpes outbreaks. It is spread through sex and skin-to-skin contact, and it is extremely common and contagious, with or without open sores. Although many infected people do not show any of the typical signs and symptoms, the virus can still be passed from one person to another through sex. Genital herpes symptoms. The majority of persons who have the herpes simplex virus are completely ignorant of their infection. This is due to the fact that they are unaware of any signs or symptoms. In many circumstances, the signs and symptoms of virus infection are so minor that the person is completely unaware of them. The first episode is frequently the most painful and challenging, as some people never have another attack, while others may have repeated assaults for up to 40 years after the first. Genital herpes symptoms include warts, open wounds, and ulcers near the genitals and anus. Itching and aches in the vaginal area, buttocks, and front of thigh. The initial sign of genital herpes is usually pain or itching that develops a few weeks after sex with an infected partner, followed by little red warts or sores that rupture and turn into ulcers that may drip fluid. Alternatively, they may bleed, and the wounds may finally heal. Wounds in the vaginal area, external area of the genitals, buttocks, anus, or cervix in women, but wounds in the penis, testicles, buttocks, anus, thigh, or inside the urethra in males. During the period when these wounds emerge, urine may be accompanied by aches, and excessive aches and sensitivity may appear in the vaginal area until the inflammation diminishes and the sickness fades. Symptoms that develop during the first episode may be similar to those seen with influenza, such as headache, muscle aches, and fever, as well as swollen lymph nodes in the groin. Genital herpes causes and risk factors. The sickness cannot be spread through the use of the toilet, towels, or other materials used by an infected individual because the presence of the virus outside the body causes immediate death. There are numerous factors that might cause genital herpes to appear, including anxiety and psychological strain, PMS, immune system is weakened, the illness, go through surgery, friction, such as that experienced during sexual activity, tired. Even though there are no lesions, the disease can be active and contagious in some circumstances. Genital herpes complications. Except for sores, genital herpes in healthy individuals has no major repercussions or complications that cannot be cured. The following are some of the potential complications. 1. The introduction of new sexually transmitted illnesses. People who have genital herpes are more prone to get other sexually transmitted diseases, such as AIDS, than others. 2. Infection in newborns. Women who give birth to a baby with genital herpes and open wounds risk passing the disease to the infant as it travels through the birth canal. Herpes infection in newborns can have serious implications, such as brain damage, blindness, and even death. Mothers who contract genital herpes for the first time during childbirth are more likely to pass it on to their child. Genital herpes diagnosis. A urologist or gynecologist should be consulted if you suspect you have genital herpes. A doctor may often identify genital herpes by obtaining a tissue sample or a sample from a small wound and analyzing it in the lab, and the infection can also be diagnosed by a blood test herpes virus. Because patients with herpes are more likely to be infected with other sexually transmitted illnesses such chlamydia, gonorrhea, and AIDS, HIV, the doctor will perform a physical examination to check that no other diseases are present. A blood test for a previous infection with the herpes simplex virus of the first or second types can also be used to detect it, and this examination can be done if a person has had a bout of genital herpes in the past. Treatment for genital herpes. Although there is no definitive cure for genital herpes, treatment options include oral antiviral medications such as acyclovir, Valtrex. Famciclovir is a type of antiviral medication. Valacyclovir, Valacyclovir. All of these medications are designed to hasten wound healing and limit the number of recurrent bouts. Furthermore, using medications on a daily basis minimizes the risk of herpes infection in the sexual partner. Genital herpes prevention. The measures for preventing genital herpes infection are the same as those for preventing many other sexually transmitted illnesses. Complete abstinence from sex or having intercourse with only one uninfected person is the most efficient way to avoid infection. If none of these options are available, the following approaches can be used. Always use a condom when having sex. Not having sex if one of the partners is suffering from genital herpes. Be cautious of frankness in the sexual interaction between the two couples. Pregnant women who are infected with the genital herpes simplex virus must notify their doctor. However, if the pregnant woman has reservations or is unsure, an examination must be performed to determine whether the virus is present. In an advanced stage of pregnancy, the doctor may advise taking antiviral drugs to treat genital herpes in order to avoid a bout during delivery. To limit the chance of the virus infecting the newborn, a cesarean section was performed. Alternative medicine. Herbs cannot treat the genital herpes virus.